Hello and good morning, everyone. Welcome back to Eldercare's training series, Eldercare Academy. I am Adrienne Ostras.
And I'm Lisa Gray.
And we are super excited to have you all here with us this morning. We have not had Matt on here in a long time, so it is definitely overdue for him to talk to all of you. And please, as always, we want this to be a conversation. We do these live for a reason. Obviously, you can tell we are here live with you. Please comment any questions that you have. If you're on Zoom, find the Q&A box. We disabled the chat, so you have to find the little button that says Q&A. Let us know where you're watching from. Let us know if you're actively selling Humana Med Supps, never sold a Med Supp before. Let us know who we're talking to this morning so we can definitely cover topics pertaining to you. But without further ado, I would love to introduce our special guest, Matt Lederman with Humana. Good morning, Matt.
Hello, how are both of you doing today?
Great.
We are doing great. And
well,
I hope
awesome.
On live is doing great too.
Well, I am. I know that we have a good group of people on today. I'm excited to share a little bit about Med Supp. So let me get my screen ready to rock, and we will get this thing moving.
Yeah, sounds perfect. Keith said he is currently selling Humana Med Supp in Kentucky. Lynn said Houston. She said hello. She's watching from Houston. Good morning. Thank you, guys.
And can everyone see my screen okay?
Yes.
Wonderful. Well, again, I'm Matt Lederman. I am one of our Director of Sales for Medicare Supplement with Humana, and super excited today to do a few things. One, kind of share like what's opportunity in Med Supp? Like, how do I kind of approach it? What's it look like in the marketplace? What are the supplement products that we're selling? And I think that there's a whole litany of products that you can look at, but I really want to hone in on a couple that we see kind of starting to take over as the Medicare market trends and things start to change. We're seeing also that same change within product selection. And so I want to share a little bit around that and some details. Also give you kind of what is our value-added services and some of our other solutions. Again, it may seem like a lot, but as I go through this, it'll be pretty darn quick. So first off, again, you guys know Matt Lederman. I handle, here's my territory, but what I want to say is I get the privilege of working with Eldercare directly. So it's awesome. So if you guys need anything, there's my contact information. I will also be sending out to both Lisa and Adrienne a whole list of things that I'll cover today. So don't think that, oh man, I got to take screenshots. I got to find, where did he get that document? You're going to be getting everything I speak about today. So don't worry about that. So what does the landscape look like? I think this is an awesome way to kind of start out the conversation about current enrollment. And so it may look super busy, but if you look on the left side, it really shows what people are thinking about as they start to age into Medicare. And it's probably, it's probably not new news to you, but 50% of people are thinking about, I'm probably leaning towards a Medicare Advantage plan. And what we say in the Supp business, that's okay. We're not trying to compete with Medicare Advantage. We're there to complement. When it doesn't make sense to go with Humana MA, man, we want you to think Humana Med Supp. And that's where it comes in that 26% of the people, when they're aging in, are thinking about Medicare Supplement. And I will tell you, this is one of the years that we saw Medicare Supplement nationally start to grow. And there's a lot of disruption and things happening in Medicare Advantage. And we think that we're going to see that continue through 27. So it's really good that you're here today to kind of hear what we have on the docket. And then last but not least, 24% of people just have original Medicare. What I tell folks what that is, man, what an opportunity. Every person you talk to needs to be in one of the first two buckets. And so there's 24% of that population that really needs your help and guidance. So what are some of those key elements or reasons that people are choosing Med Supp? It's probably not rocket science, but their ability to go to the doctors and hospitals within the territories that they serve, or where they live, the communities. And so as we see sometimes networks shifting in Medicare Advantage, Medicare Supplement in those rural areas could really become a key element. So, depending on where you live, where you're targeting for sales, this can be a really cool option. When it says want all medical bills paid for, what does that truly mean? It means that they didn't really understand the coverage that they had. And they're looking for more consistency. And so I always tell folks, when they're saying like, I want all my medical bills paid for, then we kind of steer them to the Medicare supplement. We say, well, do you want to pay your premium up front and then everything is covered? Or do you want to have low premium and then you pay as you go? And so it's that kind of mindset. Like, what are you really looking for? Along that same line, like, where do we see like prime areas for Medicare supplement? And this is kind of highlighting the opportunity. When you look at this graph, you're going to see the legend down on the right side where it's highlighting, okay, we've got navy blue, then light blue, then we turn to a shade of green. This is all the current enrollees in Medicare supplement across the country. And so depending on where you're at, this kind of gives you a good lens to look at and say, man, I happen to be in Arkansas. I had no idea there was 211,000 Medicare supplement enrollees today. And so it might make you think, how many Medicare eligibles are there in Arkansas and what is that percentage? And then as an agent, what I would be doing is looking at my block of business to say, am I balanced? Does it look like the state that I'm participating in? Or am I way heavily indexed in one over the other? And I think as we start to see the market shift and trends, we really need to think about balance, because we don't want to have all our eggs in one basket. It's kind of like the whole investment strategy, right? Like, let's not all put it in one stock. Let's spread it across 50 stocks. And then when one does good and one does bad, it doesn't hurt as bad. Kind of that same philosophy as we start to look at the segment this in 26. And then just, general overview. What I think is really cool is, why are people selecting this? I think it's predictable. Cost is absolutely critical. We get that time and time again that, I know what I have to pay up front, and then after that, it's going to be taken care of. I think nationwide coverage becoming more and more of a talking point. And then the other two that I think are really big is the referral and network restrictions. You kind of combine those, that people aren't having to get prior authorizations. And there are no network restrictions, right? The doctor just has to take or accept Medicare assignment. And as I will touch on a little bit later, about 98% of the doctors accept Medicare assignment. And so it gives you a very wide, robust access to some of the main facilities across the country. So what are the Humana products? I'm going to go through this a little bit quicker because I do want to leave some space for time. But Humana has two main products. The first one is our traditional product, core product, the one that's been in the marketplace 30 plus years. It is in 46 states right now. We also have a secondary product that we have in the market, and it is called Achieve. You can see from this map, this is where it's located. It is in 26 states. One of the questions you might ask yourself, well, what if there's overlap? What if we've got your traditional product and your Achieve product in the same state? You're going to have two product options to choose from. So some states will have that benefit. Some won't. You will probably ask next, what's the biggest difference between the two? There is only really one difference, and that one difference is the core product comes with silver sneakers, or the traditional product. Achieve does not have silver sneakers. So when you're thinking about, and again, then the other piece probably would be premium. There is a small premium difference between the product. But again, those are truly the only two things. The traditional product has silver sneakers. The Achieve product does not, and there'll be a premium difference based upon the state and product that you have. Where are we competitive? What's that look like? And I would tell you that right now, these are kind of the top 10 states. We kind of listed out 10 states for our traditional product, 10 states for our Achieve product. That's why we're going to be sending you this document afterwards, so you have this. We don't want to say that we're competitive everywhere across the United States, but these are areas where we think we have the opportunity to win. And so, if you're located in these areas, awesome. Again, I will tell you, this shifts with the wind. And so this is updated every quarter. As you all know, carriers come in with new rate increases, and that dramatically shifts positioning on where carriers are at. So if you're not quoting us one month, I would say don't do that every month, because it can drastically change month to month. And so, stay up on who are those top carriers that you want to do business with. Moving more into the product scope, and I think this is really where the fun can begin, to try and give you a lay of the land and make it simple as possible. You're going to see a whole litany of products, and you've probably seen brochures with this kind of layout before. I would love to say, especially if you're new, don't get caught up in all of this. Really take your eyes to the light green, where you see F, G, and N. And I would say that is your primary selling columns or windows, swim lanes, whatever you want to call those. And so, yes, you might be pulled into conversations on other things outside of that, but 99% of your time is going to be spent on these three products. And then I would say to even kind of shrink that is Plan F, and that's where we'll start, is becoming less and less of an option for people, because the only folks that are eligible for that are folks that became Medicare eligible before January 1st, 2020. And so if you don't fall in that realm, that's not really a product option for you either. And so again, as we looked at 2026 AEP, primary business is coming in G, N, and high deductible G. And so those are the three products that I'll probably really want to hone in on here today to kind of give you a lay of the land of what the future might look like. Just general premium, and you might look at these and say, well, that doesn't seem right, but we always like a reference for what is cost. You can look at G, N, and F there at the bottom. They've got the little check marks. These are national averages. And so when you think about a state like New York and California, premiums are a little bit higher than some places in the Midwest. And so when we're looking at G, we're kind of combining that across the landscape to say, we're seeing the premium for a G is about 162. And I will say that over the course of the last 2 years, with things like COVID impact, higher utilization, higher healthcare inflation, and then some of the recent MA actions that's caused a lot of Plex business. So folks moving from a Medicare Advantage option into a guarantee issue option has also kind of contributed to a little bit higher increases than what we've seen in the segment overall. We are looking at Plan N becoming more and more popular with an average premium of 121, and then the high deductibles F and G, really that lower set, looking at that $45 range. So when we think about plan options, what are those key things that we really want to make sure that we highlight? So when I'm thinking about Plan G versus Plan N, and I'm an agent, what do I want to think? Well, Plan G's got a higher premium. I would say that when you look across the Humana platform, G versus N, there's about a 30% difference. And so it's pretty substantial when you're talking to a client like, hey, what are we trying to decide here? Well, there's about a 30% on average, usually, difference in premium. And so I'd say that's the first piece. Then it really comes into, after the premium discussion, we all know that Plan G, you meet the Part B deductible and it's covered at 100%. Okay, well, that makes it really simple and easy. So if you're looking for something simple and easy, that is maybe a way in which you're leaning into that type of option. However, when you're thinking of the Plan N, well, it's going to have copays, and it's going to have excess charges. And so those are some things that you might have to weigh between the two plans. The one thing that I will caveat about excess charges, and I'll share a little bit more about that, is one, an excess charge is some provider that does not accept Medicare assignment. And I'm going to get into some of the details of Plan N, but one of the territories that you don't have to worry about when it comes to excess charge is those 7 states, because those 7 states don't allow an excess charge. So that kind of takes that little caveat off the table when you're thinking about Plan N. So what are some of those details or benefits of Plan N? I'd say first and foremost, it does have copays. And those copays are up to $20 and up to $50 for ER. So you are going to have to be used to copays. Now, what am I giving up by selecting G? Well, I'm getting a lower premium. So, all right, well, I'm going to have a copay, but I am getting a lower premium per month. The excess charge, as I mentioned, those 7 states that they don't apply, but what about the rest of the states? Well, just so you know, there are providers cannot charge excess charges if they accept Medicare assignment. So how many providers are out there? Right now, the number is about less than 2%. So very few providers are even able to charge an excess charge. And out of those providers, and again, this is us, how many claims are we see coming in? Less than 0.5%. So it may seem like a scare tactic when you might hear, well, there's an excess charge. Yes, there is, but the opportunity is very small. And the one thing that I would tell agents to do if you're leaning in towards them, find out who they're seeing, who are their providers, what hospitals will they be visiting if they need to utilize those services, because you can meet that objection with information and data to help support why it would be a good fit. And most of the time you're going to find out their primary care, maybe their specialist hospital, are all accepting Medicare assignment. And so that kind of wipes that issue off the table. And so again, it's good to know what are the plan options out there. And we really have seen in AEP a lot of people moving towards Plan N. There's a couple of reasons. One, it's got a lot less adverse selection into it. Because when people do get guarantee issue or trial rights, most of the time, depending on the state, I'm not going to say all the time, but most of the time, people can't go into a Plan N. It has to be on initial open enrollment or through an underwritten process, which then again keeps the block a lot more healthy. And we've seen renewal increases on Plan N be about half of that of Plan G, which is a really big thing when you're talking to your client because they're looking for consistency. And so understanding that balance, what you might be gaining from a premium perspective, giving up in benefits, and then understanding the renewal philosophy from carriers can really help you leverage and position these plans appropriately. The last plan that I want to hit with that we are seeing some activity on is the high deductible plans. Most definitely the high deductible G. You might say, well, my clients aren't interested. Maybe not now, but again, it's really good to have a wide scope and understanding of what is available so that you're educated to be able to make sure you're meeting the needs of that customer. First off, you can see the difference in premium. You're talking over that $100 mark. It's really substantial. However, you're going to see that the yearly deductible is $2,950. So that's a big, big number. The first thing that I always share with agents is, depending on the premium difference between the G and the high deductible G, for this example right here, you're going to save about roughly $1,500 in premium. That pretty much cuts that deductible just from a premium perspective almost in half. And so you got to really understand what that delta is if you're moving in this direction, and understand the consumer too. Like, are they savvy? Do they understand insurance? You don't want them to be confused, because on this plan, you're going to have to meet that deductible before the benefits kick in. And what I mean by that is, once you meet the $2,950, then it works just like a regular G. So explaining it can be simple in those terms, but understanding how it works underneath is what can become the challenge. And so you'll see that I've got a bullet there, after Medicare pays. So a lot of people think, man, I'm just going to go to the doctor and every bill I'm going to get, I'm just going to pay up to the $29.50. And that's not really how it works. That bill gets sent to Medicare. Medicare pays their portion, which is usually 80%. And then the remainder goes to the member, and then they will pay that 20%. That 20%, yes, will go towards that total deductible. And if they meet that, then it will kick in just like a Plan G. So really, it's a great benefit. Again, I will tell you that when we look at our renewal increases on this plan, these are really low. These are sub 2%. And again, it goes to not having a lot of membership on there, people that are very savvy consumers and that really are prioritizing the benefits that they're choosing. So again, really, really interesting product here. I wanted to give you just a quick example because I think, seeing it and understanding how it works can really kind of make this really a lot more relevant. And I always like doing okay, somebody took a high deductible G and it's their first doctor visit of the year. So high deductible G, first doctor visit of the year, and it was approved for $350. So step one, yes, your Part B deductible applies. So the member would first be on the hook for $283 because that's what the deductible is. And that would be paid by you. So out of those approved charges, $350, we would minus the $283 deductible, and we're still left over with $67. As I told you, after you meet that Part B deductible, that $67 then would go to Medicare. Medicare is going to pay 20% or 80% of that, and then leave the member with the balance, which is $13.40. So when you think about this visit to the doctor, it would be the Part B deductible of $283, the coinsurance of $13.40, and the total doctor visit of $296.40, which again would roll up to that total deductible and out of pocket of $29.50. So again, just an example. I know I'm going through this fast. You're going to get this so that you can look through the details of this and use it if you would like. So it can be a helpful little tool and resource. So what makes us different? This is going to take about 3 or 4 minutes, and then we'll open it up for some questions. But here's what I would say makes the Humana plans different. First and foremost, we have real-time underwriting, meaning you as an agent submit an application electronically through our enrollment platform. In under 5 minutes, you're going to have an answer back. Am I approved? Am I declined? Or does the underwriter need a little bit more information to finalize that information? It's really effective for getting back to you so that you can get back to your client to know what are my options and how are we going to proceed. We've also increased some service enhancements as we're moving into 2026 by giving full-blown access to you as an agent to our underwriting teams. We are giving a 1-800 number with a prompt that then connects you straight with our underwriter, because you might have questions on members when you're sitting down with them or they call you about would they qualify? I don't know. Well, instead of maybe going through the application, maybe you want to reach out and talk to one of our underwriters. And so we've got that availability to you. We also have a multitude of household discounts. You can see that we have 2 distinct different types of discounts. We have the first one, which is the enhanced household. You'll see that is EHHD. You'll also see that we have an HHD. The difference can be product and state. So you might have an Achieve product. It could have a EHHD. You might have a traditional product. It could have an HHD. I will be sending you a flyer by state that tells you which product is in your state and which discount is applicable. The difference between the 2 discount definitions, EHHD means, do you have someone living in your house? If you say yes, you qualify. So EHHD, do you have someone living in your house? Yes, you qualify. HHD you have to have two people in the household taking the same product. So two people in the household taking a Med Supp to qualify. Two distinctively different discounts, but we will be sending you a flyer that outlines that per state and by product. Also, so you know, we also give a $2 ACH discount, which is awesome. So if they're willing to do automatic bank draft for their premium, we're going to take $2 off their premium on a monthly basis. One of the key things that we are the only carrier that does this in the industry. But if your member wants to pay using their credit card, we will allow credit card premium payments. We hear this a lot. Like, I don't want to give you my banking information. Not a problem. You can set up your ACH payments through credit card. And for those folks asking, there is no additional fee to do that. And then last but not least, Humana has 0 policy or application fees, which, again, is something else you have to explain to the member. And nobody likes to go through that process of saying, hey, guess what? To put in an application, it's going to be a $25, $30 fee. We kind of waive that to make it as simple as possible. Last but not least, and then I'll kind of stop and open it up for questions. What are those other things that come with the Humana Med Supp? First and foremost, as I mentioned, we have 2 products. One's our traditional, one's our Achieve. Silver Sneakers is one of our additional benefits. It comes with all of our traditional products. We also have hearing, vision, our Lifeline services, all discounts ranging somewhere off retail of 35 to 40%. The member, when they do sign up for any of our products, they receive all of these discounts, and they'll get a packet on how to utilize those. And last but not least, we also have a Dine benefit. This basically allows the member, when they're in inpatient facility, skilled nursing, hospital, upon returning home, we know it can be extremely tough for the member to be able to get back on their feet. This allows the member to be able to have 2 weeks of meals sent to their house for free. They can be put in their freezer, refrigerator, and used at their convenience while they're trying to recuperate and get back to normal. Again, these are some of the additional benefits that come with all of our Med Supp programs. I know that we are at the end of the hour, and I just appreciate, I think, you all allowing me the time to, 1, cover the opportunity, number 2, cover the products and what we're thinking and seeing in the landscape, and then what are the reasons why I would choose Humana over others and some of those key differentiators. And so I will pause there with about 3 minutes left and turn it back over to Lisa and Adrian.
Awesome. Thank you so much.
Great. Yes.
That was a lot of great information. And I like how you talk about what the opportunity is, but I feel like just saying that there is still an opportunity for Medicare Supplement is really important. I'll tell everyone, that's what my grandmother is on. She's lucky enough to be on an F. but and that's what she will always stay on, for the peace of mind for all of us.
Yeah, sure. Yeah, for sure. Sure.
But we do have some questions. I have Brian on Facebook Live. He's asked, does Humana allow a beneficiary to switch plans within Humana without going through underwriting?
Actually, right now we do not. That is one thing on our list that we are looking at. And again, there's always trade-offs with doing it, right? But we're trying to understand from an actuarial perspective, because the one thing we don't want to do is apply more financial pressure, as we're kind of experiencing that right now in the segment as a whole. And so we're really trying to weigh our options. Can we do this to make it more complementary to come to Humana and be a benefit to hop around the product portfolio? Again, I think we'll have more of an understanding with that as we move through Q2, but it could be something on the horizon that we might be changing. But at the moment, no, we do not allow it. You have to go through underwriting if you're switching plans.
Okay. All right. Thank you for answering that. And Stephen had shared how exciting it is that you're possibly going to be allowing access to underwriters. Did you say that was active now?
Yes. And you'll be getting a flyer. It's called a contact flyer. Like, when I got questions, who do I send different things to? It's going to have the underwriting piece on there that you're going to be able to see the 1-800 number option 4 that's going to give you that access.
That's awesome.
Yeah. Cherie said, great presentation. Thank you.
Awesome.
I know that we had a few people in Texas watching and Georgia, but I noticed Keith was in Kentucky. And so whenever you showed that map, Kentucky is one of those states that both products are really competitive. So congrats to Keith for having all that opportunity.
Yes.
Freddie asked if there was a replay. Yes, we have recorded this for you and we'll send it to you. Lynn, how does the RX plan work? Lynn, are you asking about like their separate PDP plan? Or are you asking about offerings? That? Or was she maybe asking about that discount? I'm not sure, Lynn. If you want to explain that more, Lynn. And then Lawrence asked, is there a time limit to stay on the high G plan?
A time limit to stay on? I guess no. I mean, any Medicare supplement that you buy is yours for life. I think that's what people like about it. I think to Adrian's point, like they're never coming off, and that's the option they choose. Like when they come to a carrier and they choose that plan, it is it's inevitably up to them if they ever want to stop that specific plan, because a carrier does not have in any state across the country to eliminate that product once a member selects it. We may not sell it anymore, but it doesn't mean that member can't have it. Once you sign up and you buy it, it is yours until you stop paying premium.
Yes. Lynn was asking about the discount. So I think whenever you were on that last slide, when you were talking about discounts, prescriptions was on there.
If it is, I'll have to go back and look. There shouldn't be a discount for prescriptions. I know what you're talking about. Yes, we do partner with somebody from a discount program specifically to be able, if they don't have a prescription drug plan, at least they would have something. I forget the name of the company we partner with. It's like a Good RX. Is kind of how I explain it. It's going to be a discount off the drugs if they don't have a full-blown prescription drug plan. However, I would highly recommend for the $10 or $20 that I know they're in the marketplace, get a prescription drug plan if you have a Medicare supplement policy.
Yeah, you don't want to be penalized for that.
Correct.
Let's see. Stephen coming in with these questions. Let's see. He says, what are you seeing in the industry for utilization? Is it still high utilization? I feel like there was a bump in high utilization during COVID, but I have to wonder if utilization is or will level out as beneficiaries are able to maintain their health again after getting caught up.
Yeah, I would say that that's a kind of a three elements in the marketplace that are creating some of these cost pressures within Medicare supplement. I would say before COVID, you never saw Medicare supplement take less, or you probably saw them never take more than about a 7% increase. Over the course of the last 2 years, I would say I'd probably say 100% of MedSupp carriers, they've either closed shop due to financial pressures, which we've seen a lot of smaller companies do that, or they've taken somewhere between 15 and 30% increases on average for the last couple of years. I would say that we are going to probably continue to see that in the future. Now, this is opinion of one. This isn't opinion of all carriers out there of Humana's perspective. This is opinion of one, Matt. I would expect to see increases continue. There's a couple of reasons. Is we have to get to a price point that makes sense. What I will tell you is when you looked at 5 years ago, the premium for a Medicare supplement was relatively $100. Healthcare inflation has in a small time frame, and then you looked back at what the premium was a decade ago, it was $100. And so it never really changed. And so we're starting to see that it's catching healthcare inflation, one. Number two, as we see more and more guarantee issue and more adverse selection come back into Medicare Supplement because of a lot of the plan exits from Medicare Advantage, it's going to continue elevating and be a little bit more challenging on cost control because we don't know what we're taking in. When you take these members, it takes us a while for them to get into the book of business and then get a line of sight to say, okay, this is what's happening. So what I would say is, as we see all markets in Medicare finally stabilize, then I think you can kind of be reassured that the Medicare supplement market will stabilize with it. As you see big variances in Medicare Advantage from reimbursement rates, that can make the Medicare Advantage market shift. So if you were to ask me in my crystal ball, I would say 27 will still be a little challenging. I would say 28, I see some more stability coming back into the marketplace as a whole. Long-winded question. Sorry, Steve.
It was a long question, so you got a long answer. It's only fair, which it makes a lot of sense. And thank you for sharing your opinion. It's nice to hear that about our industry.
Yeah,
so,
for sure.
But there's still a lot of opportunity, and consumers still need all of you to help them navigate this. And we appreciate everything that y'all are doing out in the field. And if you do have further questions, or if you're not already set up with Humana, please reach out to us. We want to help you get set up with them and help you, be successful selling the product, as well as qualifying for like all of Eldercare's goodies when you sell the product.
Yeah, give us a call.
Yes, please. And thank you, Matt, for taking the time. I hope you all have a really great rest of your day.
Thank you all. Have a good weekend. And I will send you that
Thank
information right after.
Yes, we'll be watching for it.
Cool. Guys,
Thanks.
take care.
Bye.